Come in.
Good afternoon. My name is Makia, and I'm your nurse for today, working with your provider. Is now a good time to talk?
Sure.
I understand you recently had a stroke. What do you know about, or did the doctor explain to you about your diagnosis?
He said I had a brain attack due to either bleeding or lack of oxygen to my brain.
All right, I'm going to define the MD's interpretation of the stroke a little more. Strokes occur when there is either inadequate blood flow to the brain or bleeding into the brain that results in death of brain cells. A stroke can affect your body's functions such as movement, sensation, thinking, talking, or emotions that are controlled by the particular affected side of the brain that was lost or impaired.
Thank you.
No problem. I wanted to talk about what it may be like for you and your family while recovering. Some changes you and your family will need to make and be mindful of.
Changes?
Yes. A stroke is a lifelong change for you, the stroke survivor, and your family. Some common long-term disabilities include partial paralysis on one side, inability to walk, complete or partial dependence for activities of daily living, dysfunction in communication, and depression.
What changes may occur that we need to expect?
One area strokes affect is your mobility, which is a motor function. Motor deficits include impairment of mobility, breathing function, swallowing and speech, your gag reflex, and your ability to complete your care independently.
Okay, so moving like my furniture around and the inability to care for myself independently at times.
Clients who have had a stroke will also need to make safety changes to their living environment.
What should my family be concerned with while going through this?
There may be a loss of skilled voluntary movement, impaired integration of movement, changes in muscle tone, and altered reflexes. This means the arms and legs of the affected side may be weakened or paralyzed. When providing and ensuring your safety at home, they will need to remove clutter from area spaces to ambulate more safely, provide proper lighting to aid in concentration and safer mobility. Assisting in arranging your living space also aids and helps with visual deficits.
I see, so this is your right. This is a lifelong adjustment. I may be facing physical challenges and require the help of my family to adapt to my new way of completing my routines. So the stroke has affected my brain's ability to function normally.
Yes. It sounds like you have a better understanding. I'd like to also offer you and your loved ones some further support with information on community support services, and we'll also be able to make referrals to outpatient therapies.